Understanding systolic blood pressure. Systolic blood pressure refers to the pressure in your arteries when your heart beats and pumps blood. It is the higher of the two numbers in a blood pressure reading, indicating the force exerted when the heart contracts and pushes blood throughout the body. Normal systolic pressure is typically below 120 mm of mercury. Diastolic blood pressure explained. Diastolic blood pressure is the pressure in your arteries when your heart rests between beats. It is the lower number in a blood pressure reading. This pressure reflects the heart's resting phase, where the heart refills with blood before the next contraction. Normal diastolic pressure is usually below 80 mm of mercury. Systolic versus diastolic. The key differences. The primary difference between systolic and diastolic blood pressure is the phase of the heartbeat they measure. Systolic measures the pressure during the heart's contraction, while diastolic measures the pressure during the resting phase. Both numbers are important for assessing heart health and overall blood pressure. The role of systolic pressure in cardiovascular health. Systolic pressure is a key indicator of heart health, especially as it tends to increase with age due to the stiffening of the arteries. Elevated systolic pressure, over 130 mm of mercury, is associated with a higher risk of heart disease, stroke, and kidney problems, making it crucial to monitor. Diastolic pressure and its health implications. While systolic pressure often receives more attention, diastolic pressure also plays a significant role in cardiovascular health. Low diastolic pressure, below 60 mm of mercury, can indicate insufficient blood flow to organs, while high diastolic pressure, above 90 mm of mercury, may signal risk for heart disease and stroke. Why both numbers matter in blood pressure readings. Both systolic and diastolic numbers contribute to the overall assessment of blood pressure. A high systolic pressure can be an early warning sign of cardiovascular issues, even in people with normal diastolic pressure. Conversely, high diastolic pressure can indicate early signs of heart disease, especially in younger individuals. The impact of age on systolic and diastolic pressure. As people age, systolic pressure tends to rise due to arterial stiffening, while diastolic pressure may remain stable or decline. This is why blood pressure guidelines differentiate between systolic and diastolic measurements, as both can change at different rates over time. Managing systolic and diastolic pressure. Maintaining both systolic and diastolic blood pressure within healthy ranges is essential for reducing the risk of heart disease and stroke. Regular exercise, a balanced diet, weight management, and reducing stress are key strategies for managing blood pressure effectively. Blood pressure categories. Normal versus high. Blood pressure is categorized based on both systolic and diastolic numbers. Normal blood pressure is less than 120/80ths of a millimeter of mercury. High blood pressure, hypertension, is defined as 130/80ths of a millimeter of mercury or higher, with different stages depending on the severity of both systolic and diastolic readings.